I have so little idea about what my patients go through.
There just really was something not right with the way that healthcare was being delivered, that the things that I was learning, I just couldn't translate them to my patients for reasons that had nothing to do with their biology or their physical health, but were behavioral, that were social, cultural.
I came to recognize that there were things going on and happening in the world that I did not see and did not know about. I came to see that racism was indeed alive and well, but it took different forms.
I always felt I treated everyone equally. And when I recognized that there were nurses and doctors who didn't do that, whether consciously or unconsciously, that was a watershed moment for me.
We definitely knew there were health disparities within our organization. Nobody should have to feel lost or scared in any situation, especially dealing with healthcare.
After a certain point, you want to say, well, we sort of know why, and we need to do something to make a difference and to make change.
It is not just medically interesting. It is much deeper than that. There is a level of humanness and that level of the human spirit that is the core of what is hurt when health disparities are present.
To close the gap on disparities is going to help everybody.
So when we think about what is equitable care, I always think that equitable care means working with your patients to achieve the same outcomes.
The Finding Answers project is really neat because I think it's an opportunity to do more than just study the disparities to try to understand if they exist, but to try to actually make a difference.
This project will help us really see what you can reap when you go through the discipline of true scientific method.
With the type of intervention that we're examining, we're hoping that the strength of the community can be brought to bear on this issue, because we know that everybody out there has some piece of it.
The feedback that we get from people and the satisfaction that they have with the improvement and how it changes their lives, it's something that it's difficult to put into words.
And so we hope that if we're able to implement this on a wide scale, that it'll reduce the disparities that we've seen between patients.
We are asking doctors and healthcare systems to really look at the way they do things and do things differently. The way we've been doing it has to change.